Today we are going to study about gastritis. So what is gastritis? Gastritis is inflammation of the stomach. It can be acute or chronic. Acute can be caused by acute reason, but the chronic can be caused by the H. pylori infection or the autoimmune gastritis. Okay. So it leads to the damage of the stomach lining, that is the mucosa lining that protects our stomach from digestive enzymes. Symptoms include stomach pain, there will be heartburn, loss of appetite, fullness, nausea, vomiting. As you can see, the healthy and the gastritis occurring in the stomach. Now we will talk about the symptoms of the gastritis, what will happen during the gastritis. There will be indigestion, there will be burning sensation, vomiting, hiccups, frequent bleaching, loss of appetite, abdominal bloating, and gnawing and burping, stomach pain, nausea and recurrent upset of the stomach. Okay, so we will talk about the acute and the chronic gastritis. So the acute gastritis is caused by the NSAIDs or any kind of shock or like curling ulcer, but about the chronic ulcer, it will be caused by the chronic reason like infection by the H. pylori or maybe the autoimmune gastritis. The sudden onset of the inflammation of the stomach lining, upper endoscopy biopsy shows inflammation of the cells, white blood cells, and the at the site of the injury, and can progress to the erosion of the erosive gastritis, and eventually leads to the ulcers, that is the complete erosion of the mucosal lining. Risk factors can be frequently long-term use. Okay, so the long-term using of the anti-inflammatory drugs or the H. pylori bacterial infections, and high consumption of the alcohol. When we talk about the treatment, first we will focus on the relieving the underlying causes of the inflammation. Treatment includes relieving the underlying causes of the inflammation, can be medication, proton pump inhibitors and antacids, or the antibiotics like amoxicillin and cyprian, and the lifestyle changes.